From that batch onwards, revised curriculum, revised syllabus came into force and existence. Why I am telling this? There were much difficulty, just like in the new syllabus of the current body, how the teacher need to get coordinated, upgrade standards of education and learning methodology. At the same time, teachers had lots of difficulties because students were very smart. One such student, Dr. Kishore, because basically he is from Bangalore. And our teacher at C.P. Dixit was there, his mother's classmate in undergraduation at GNC Bangalore. And he used to guide our C.P. Dixit madam by preparing the slides, helping her by preparing various other audiovisual programs. Means he stood by the teachers for the quality education. And we came to know he became the best outgoing student in the high school where he studied in Bangalore. Both of the parents, father and mother, are Ayurveda practitioners, doctors, serving to the community, established their own clinic and dispensary at Bangalore. And he used to come to me and tell myself, when you go to I went North Karnataka. And in his own language, he used to tell, sir, you really do good, man. Then I told him, yes, definitely, North Karnataka politically being a very much ignored area, the social tendency, political ignorance, economy of the people here, and one such surname used in this area of Karnataka, Dudapnala, because he is full of dust, Dudu, dust. And I used to laugh whenever Kishore says, yes, Uttar Karnataka area. Actually, it is Bangalore, Bangalore, Mumbai, Delhi, Goa. Means how an Ayush practitioner should come forward with all the qualities. After his BMS graduation, he visited several countries, and he used to be the part of our alumni association, through the association several times for his achievements. Being our honor, he was honored, and for any induction program, bridge course will be incomplete if there is no issue, just like I told regarding Sanjay. Then after he thought, let me complete AMV Ayurveda. Started practicing Ayurveda, practicing Panchakarma, and got for 3 years. My daughter, when she used to be in first standard, when Kishore visited my place, she saw, I saw this uncle in the TV. Mr. Brown in the TV means how much you are supposed to be very popular. Now also, she used to ask whether Kishore uncle is connected or not. So with the teachers, with the early population seniors, how Kishore has got a great connectivity and relationship. After that, he thought, let me join for PhD also. So now, the ongoing PhD program in Sanskrit University, along with the very first doctor from the Indian system of medicine to become the member of Karnataka Kannada Pradhikar, which is beyond our imagination. Some of our medical experts, they become members of the board or the university different academic and basic boards, including the faculty. But why the Kannada Pradhikar? When he was telling me, it is our strength that we have to promote the language and the opportunity given to me, I have definitely utilized it. He became the personal physician of the then governor of Karnataka, Srimati Ramadevi. He used to tell once we will go to Rajbhavan and we will meet the honorable governor of the state. Very rarest of the rarest opportunity. An Ayurveda doctor will get the family doctor reward from the government, that the governor and so. So we are very happy that for our invitation, anytime being told to Dr. Kishore, ನಾನು ಬಂದ್ಬಿಡ್ತೀನಿ ಒಂದು ದಿವಸ ಹೇಳ್ತೀನಿ ನಾನು ಬಂದ್ಬಿಡ್ತೀನಿ ಸೀದಾ ನೀವೇನು ಚಿಂತೆ ಮಾಡ್ಬಿಡಿ ಬೆಳಿಗ್ಗೆ 9 ಗಂಟೆಗೆ ಇರ್ಬೇಕು ತಾನೆ ಎದ್ಬಿಡ್ತೀನಿ. So today he is here, he will be sharing his views, and once in a seminar he used to explain regarding a patient of allergy. I told my PGs, even I too had an experience of such a patient. A case reported to me with a history of severe and multiple rashes over the chin of the face, and used to be recurrent, he used to tell. Probably a person of adult of 50 years plus, a government servant, an officer. Why this rash? Probably some shaving cream allergy or some soap on something which is causing allergic rashes. No, some follow-up made. Nothing. After a few days again he came. You give some medicine like Rasul Shekara, some Puti Karanjasava, something like Eladi, ointment. My condition comes, disappears, remissions, exhaustions. I'm not understanding it. During several visits, once along with his wife, he came. I was sitting, looking, okay, with all hair dye. Maybe with the good cosmetics and applications. And left. Then I remembered Kishore. Kishore in the talk also telling regarding the same case. You know, I'm also getting the same case or with similar history. Maybe this hair dye is causing the allergy when his madam is together. So that the nidana or the hetu of the patient used to reveal with the allergic rashes through the contact. Probably that is being revealed and critically analyzed. Why I am telling, with a very small point, a very small clue given by the individual, you can expand the diagnosis, exercise on it, and identify what is the exact cause behind that. Until and unless the hetu or the reason is not found or attended and addressed, the patient is not going to get the happiness. And when you told, madam, if you change your hair dye, probably the applications on the face, our sir is not going to get any allergic rash on the face. Then she was okay. No, this is the thing what is causing the allergy on our his face and skin. Now you might have understood what is the reason. With all sayings, Dr. Kishore, our pride enemy, is here to motivate you. In the last talk I told you, for any motivation, Lord Hanumanta is the role model, because Anjaneya from this height used to grow to the height of the sky, jumping from various areas, from Rameshwara to Sri Lanka, Colombo, Ravana's place, from there to here, and Sitanveshana, from there to Sanjivini Parvata, bringing the medicinal herbs. Why means motivation. Motivation is always required. Don't get demotivated. Always with positive attitude, very much constructive energy. Try to attend, listen carefully, and be happy. Thank you, Dr. Kishore, for your presence here, and always be associated with our institution.
Our institution, today's President, Dr. A.S. Prashant sir, with a token of law, is given by the Pramod First Year Senior CR Commendation. Similarly, a warm welcome our beloved alumni Dr. C.A. Kishore by First Year Senior Patil Kulkarni is coming to the token of law. Now, Kishore sir is continuing the. Thank you.
Am I audible? You want to make it more louder? As you know, beautiful introduction and heart-touching introduction given by my guru, my preceptor, Dr. Prashant sir over here. I strongly feel I'm not worth that introduction. And he said, when he invited, I'm supposed to come here. And I agreed. I deny that. He has got every right to command and demand my presence, and it is my responsibility to adhere to his words and be with him as long as he is there, not just in the college, as long as he is alive, as long as I am alive, as long as this mother institution is alive. This is my first rollout to Dr. Prashant sir. Without him and without Dr. Panigwal sir, who was the senior most professor and who is into heights of Ayurveda at the national level, I wouldn't be here today in front of you. So, welcome to one and all. It makes me very nostalgic because 31 years back I was here. 31 years back I was here. A lot of LLBs were there. You might be thinking, what is an LLB doing in a BAMS class? BAMS itself has to be renamed colloquially in a very modernized approach as a bridge between Ayurveda and modern science, not just Bachelor of Ayurveda Medicine and Surgery, is my cry and my wish and my anguish that it has not been happened hitherto. And why LLBs in the BAMS class is because lots of last bench is LLB to me. So they sit there comfortably, they walk out, not serious. The then not serious youngster students, even though not serious, quacks, underqualified, or not qualified, or not successful human beings that I am seeing for the past many years. First thing is, why a motivational class is being required. I never carry a pen drive, I never carry a PowerPoint presentation, I never get prepared for any talks for the reason that, I should get to know the pulse of the people. Then only I will be confident enough to deliver what they need. Any talks for that matter, when it happens, it's not just I talk what has been prepared by me in my office, have a PowerPoint presentation, and try to explain basic funda A, B, C, D to you all, and just move off. Most of the things I'm pretty sure it will go off the head. Why an impromptu speech is being done by me, and why I want you to do it in the due course of your professional tenure as the upcoming doctors you are as of now, is for the reason that when you get to know the pulse of the people at that given point of time, you invade, you intervene, and you try to see that the best of yours is being delivered to them. Because this is the golden age for you to think, act, and achieve. You can think any number of things, any wrong things, good things, bad things, but you have to think. And whatever the positive things, amidst those things, has to be achieved, for which you should have a goal. Today, see, sir was telling much high about me visiting multiple countries, me visiting the governor's office, me visiting multiple ministries, IAS, IPS, they are my patients, as a part of Kannada Development Authority. Now I continue to be the member of the Central Board of Censor Certification, CBFC. What all movies you are seeing is been certified by me for the past 3 years, multiple things. The intention of he sharing my anecdote with you is that, one thing is, yes, to whatever I am, you should be connected. The teacher is what I mean to say. You should be connected. The institution is what I mean to say. Most of the times, the most happiest moment the student will get a successful career will become only when that particular student, after his success in his personal and professional life, that student is being invited to the mother institution and he is made a chief guest or a chief speaker or a motivational speaker level, and see that he is being introduced as a role model to other students. That is the biggest achievement, biggest accomplishment, biggest success what a student can achieve being successful in that particular institute. I am so grateful and humbled. I enjoy this in my school life, very much. I go to my school every year, be with my students, share my thoughts and come. I am so with my second year QC college, first year and second year where I am so. This is my mother institute. The moment I see Dr. Prashant sir, I see this college overview, Kannada ಹೇಳ್ತೀವಲ್ಲ ತುಂಬ ಭಾವಗಳಾಗ್ಬಿಡ್ತೀವಿ ಅಂತ. I will be speechless for 2-3 minutes because this is a nostalgic feel to me. There were days, I have shared this with you because sir was a final year teacher. It was his early days of his teaching when this our 96 batch, Rajiv Gandhi started. Sir made a glorious entry after his PG from Kerala. That point of time, Ayurveda doctor completing Ayurveda was a huge Herculean task. Post completion, practicing Ayurveda was a very long-sighted phenomenon. And to establish after PG in Ayurveda, as sir was saying, Dirty city then, now it's a beautiful city, that's a different story. Dirty city then, he is starting an Ayurveda clinic with Dr. Ramchandra Pandey, I believe, near the child. And 5th or 6th day of my student tenure here, when I was like you, I went to his doorstep and said, sir, I want to be with you. Because he was so jubilant, he was so vibrant, his qualifications, his success stories, what was here and said to us was very, very, very high. So, Guruvina Gulama Nagavathanaka Dorayudanna Mukti is what is being said in the history. So I just wanted to be his slave virtually then. The decision of me being his slave, I went to his doorstep, said, sir, I want to be with you. He said, what will you do? You are just in first year. And he was supposed to be a teacher to us when we come to our final year for Kai Chititsa. So, first year BMS, being in touch with one of our alumnus, one of our seniors, all the names and all the boards, all gold medals, success, accomplishment, see. Then, budding practice, officer 32 years back in Hubli, with bold and relentless tagline by saying that pure Ayurveda has been practiced. And 6 to 7 months, he attained a very good name, very good glory. And in fact, of course, he is now the talk of Karnataka and India. That's a different story because of his intellect. But sir, when he came from Kerala, he was started his practice in Kopika Road. 4 or 5 years later, I believe, sir. Initial days was in Girgacha, later on. So then sir shifted to Kopika Road. There were queues of 50 to 60 patients a day whom he would cater to from classical Ayurveda. And just imagine, even today, to handle 50 patients in Bangalore is a nightmare. Sir used to see 60 to 70 patients 30 years back for pure Ayurveda. To what are people like me today? One of the inspiration is something like Dr. Prashant, something like Dr. Srinivas Bandigod, something like great teachers over here. Second important thing, it is not my talk, it is the talk for you about you. That's the reason I am investing more time and I wanted sir to sit here because if he walks away, he will not be knowing what I am speaking. And then you might convey to him, might not convey to him, but he should know the faith, the belief, the strong intent what student can imbibe if at all, if a good teacher is there. So I am here not to tell about myself. Today I am here to tell about some good teachers who have got us good things. I am here to tell about bad students who have not learned the knowledge properly. I am here to tell you about good students who have thought of good things and become successful in life. Acharyat padamadatte, padam shishya svamehe, padam sabrahmacharya, padam kalena bhajyate is what the saying goes. I owe 100% of my success to the Guru here, but the story says, the Ukti says, 1/4 of the knowledge of the whole what you have learned or what you will be learning is from a Guru, right? So, this is the time for you to explain, explore, do wrong things and succeed in life. You can do n number of mistakes, max to max. A teacher sitting from this end might scold you, might try to reboot your system, might try to correct you, might try to intervene in your professional life, do some modifications and see that you are better. But as long as you don't quench the thirst, you go and say, if baby doesn't cry, today's modern mother is not going to breastfeed the child. Yes or no? You've seen your sisters, mothers and brothers, children. There was an era where the mother used to feed, keeping an intuition that the child would be hungry. Now the situation and scenario has changed. Now the baby should cry, alarming situation should be coming, then the mother should have an inclination that it is time to feed the baby, and I am going to feed the baby and spend time and feed the baby and nourish the baby and go on. So is with the education today. If you think everyone will be Dr. Prashant, next to impossible. If you think it is the teacher's responsibility, I have paid my fees, I have got high marks in my 12th standard and PUC, it is their responsibility to give me knowledge and make me successful in life, absolutely you are wrong. If you think my attendance is pakka, I am here, I will somehow pass the exam, take my marks and get out, still you are not successful, because none of us, if you ask the legendary thespian veteran Ayurveda Dr. Prashant over here sitting in front of us, if he asks what do you do, he says I am practicing. He, being a stalwart, also shall not say that he is a perfect man. That is the humbleness what we all should have. Here practice because we perfect illa. Every patient is a new patient. Every friend has a new positive domain to see. Every enemy of yours, if at all, if you develop, which I don't want you to develop in the classrooms, but if at all, if you have an enemy, see that you win over him with the cutting edge, with the positiveness that he has, and try to see that the best of years is being given to him, so that he will succumb to your softness. Maybe 2 or 3 months down the line, he will become a very good friend to you. Padam Shishya Swamedha is the second phrase. 1/4 of the knowledge, only 1/4 of the knowledge can be absorbed by you from this institute. So what about the rest 3/4? Talking to good friends, making good friends, connections with the teacher in a very positive way, extraction of the best knowledge of the teacher. There were days in which we used to just stand in his aura, stand in front of him, near him in the OPD, so that he talking to the patients would give us a lot of confidence, so that ये तरह प्रश्न आप ले लो, ऐसा ही प्रश्न पूछ सकते हैं, ऐसा बात करते हैं तो जो अंदर नहीं निकाला है मुंह से जुबान से वो बाहर से जुबान से निकलने के लिए क्या तजुर्बा हमें होना चाहिए कि उसको निकालने के लिए. The interrogation, the counseling perspective, the explanation and the history taking, that is an art which you should learn from the day one. This happens because you are all from the different walks of life. How many of you from non-Karnataka? Raise your hands. 3, 4, 3, 4, 5, 6, 7, 8. 8 of you are non-Kannadigas, right? All others are from Karnataka only. How many are from Hubli? Hardly few. So it is a combination of all districts you are here. Very fine. So first thing is accept the place. Good or bad, you cannot leave Hubli for 5.5 years. Accept the place. Next, accept your colleagues. co-mates and co-friends, because you have to live with them wantedly or willingly or unwillingly, you have to be with them. The third thing is try to have very good connects. Acharya Padam Agatte, Padam Shishya Svavite. Padam Sabbrahmacharya is what I mean to say now. I don't want you to talk in between, you can talk to me, or else you can come and talk here, I will sit there. I don't want you to talk to yourselves, this is the disclaimer now. Having good friends, having a very good interaction amongst people will give you a lot of positive knowledge, will give you a lot of courage, will give you empathy and sympathy amongst yourself to see that you will have a good professional career. Next, most important, try to be a very good listener. Every one of us are speakers, isn't it? We always tend to speak and we have fear. Teacher hoದ್ರೆ ಬೈದ್ಬಿಡ್ತಾರೆ, question ಹಿಂಗೆ ಕೇಳಿಬಿಟ್ರೆ ಅವ್ರು ನಾಳೆ ಬೆಳಿಗ್ಗೆ ಟಾರ್ಗೆಟ್ ಮಾಡಿಬಿಡ್ತಾರೆ. All such things you will be having in the soul. Is it or not? Yes or no? I want this interaction. Your principal is not there. I want this interaction to be absolutely fearless, and you can interrupt me. You should not disturb me. You can interrupt me. If you want to say something, you can raise your hands and say. You are all the more free, because I am not going to become your examiner. I am only a motivational speaker over here. So keeping this in mind, I want you not to fear. No fear when Ayurveda is here. This is the tagline. What you should have. So, how was the days, when we were here very simply? I was always sitting over here. That was my place for all the 4.5 years of the tenure of my studentship over here. The first question what I asked my teachers when he came and when the induction class was happening there, at the then era, Mutra, Malabandra, Mutra first hogtave yaki. When we try to feel, when we feel urination and defecation simultaneously, what will happen? What is the natural urge coming out first? Louder please. No teachers are here. Only you and me. Feel free. Huh? Why? Any one of you boldly stand up and say why? Any one of you stand up and say, give me the reason as to why. Yes, lady, you tell me, the first one with the apron, tell me why. Neither. Gottilla, nothing else. How did you say it? Intuition, huh? Guesswork. Anyone confident? That was my question. You know what was the answer? I will not slap you, but he slapped me. He slapped me on the face and he wanted me to get out of the class, which I will not do it to you. Then I was standing like a kutta outside. Then he came and said that, Nangu Guttel useless full Allah on have question. So, why I am telling you all these things is because if you have fear, you can't excel in life. If you are introvert, you can't excel in life. If you are not opening up, don't share your thoughts, you cannot relinquish. So, what is the sutra for success? Can any one of you tell me what is the secret of success? Sutra for success? Stop, no? You बोले ना डॉक्टर साहब इधर ही डॉक्टर्स बनने वाला लोग बेटा है कोई जुबान ही नहीं निकलता बातें नहीं करता तो कैसे सीखेगा? You have the introduction of each other at least or not? You know each other here or not? No. You don't know anyone over here. You simply come like this, sit and get out. Is that the story? You have introduced yourself? Then tell me, how should you become number one? What's your aspiration to become number one in life? Do you have the dream or not? Or you want to be yet another doctor sitting in 10 by 10 doing injection practice, putting bandage and all do quackeries? Is that your mindset? Or you want to be traditional, classical, powerful, evident, most strong Ayurveda physicians? How many of you have to be Aam Aadmi Ayurveda doctors? How many of you? So does it mean to say that every one of you have to become, to aim for excellence, to become successful doctors? At least, how many have the dream to be successful? Raise your hands. Everyone. So what is your input to become successful doctors? Coming to college, taking attendance, getting exams, finishing the exams with some marks card and getting what makes you successful doctors? Hello? If you don't speak now, I will walk out. What is success according to you? I will choose if you don't respond now. I will make you stand up and ask questions. Okay, that apron lady next to that red lady. You. Yeah. ಏನಾಗಬೇಕಂತಿದ್ರೆ ಮುಂದೆ ಏನ್ ಮಾಡ್ಬೇಕಂತಿದ್ರೆ ಮುಂದೆ which language you want me to speak to? Louder. ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೇಕಾ? ಟೀಚಿಂಗ್ ಹೋಗ್ಬೇಕು. ಏನ್ ಮಾಡ್ಕೊತಿದ್ರಿ? ಕೇಳಿಸ್ತಿಲ್ಲ? ಕನ್ನಡ, ಹಿಂದಿ, ಇಂಗ್ಲಿಷ್ ಯಾವ ಭಾಷೆ? ಏನ್ ಮಾಡ್ಬೇಕಂತಿದ್ರೆ ಮುಂದೆ? ಯಾರ ಪೇರೆಂಟ್ಸ್ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ ಇಲ್ಲಿ? ಎಷ್ಟು ಜನ ಪೇರೆಂಟ್ಸ್ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ? ಅಪ್ಪ ಅಮ್ಮ, ಬ್ರದರ್ಸ್, ಕಸಿನ್ಸ್, ಸಿಸ್ಟರ್ ಇಲ್ಲ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರಾ? ಕಸಿನ್ ಡಾಕ್ಟರ್ ಇದ್ದಾರಾ? ಆಯುರ್ವೇದ ಡಾಕ್ಟರ್ ಇದ್ದಾರಾ? ಅಲೋಪತಿ ಡಾಕ್ಟರ್ ಇದ್ದಾರಾ? ನೀವು ಹಂಗೆ ಎಕ್ಸಲೆನ್ಸ್ ಹೊಂದಬೇಕಲ್ವಾ ಲೈಫಲ್ಲಿ? ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಬೋಲ್ಡ್ ಆಗಿ ಮಾತಾಡೋದು ಕಲಿಬೇಕಲ್ವಾ? ಸುಮ್ಮನೆ ಹಿಂಗೆ ಕೂತಿದ್ರೆ 4+3 = 7 is not going to run the show henceforth. Alva, you have to create, invent, renovate, discover, research, do lot many things to experience success in life. Alva, first bench ಹೆಂಗೆ ಕೂತ್ಕೊಳ್ಳೋದು ಧೈರ್ಯ ಮಾಡಿದ್ದೀರಾ? ಫಸ್ಟ್ ಮಾತಾಡೋದು ಧೈರ್ಯ ಮಾಡಿ.
ಸಕ್ಸಸ್ಫುಲ್ ಆಗಬೇಕಂತಂದ್ರೆ ಒಬ್ರು
ಎಲ್ಲರೂ ಕೇಳಿಸ್ಬೇಕು.
ಈಗ ನಾನು ಡಾಕ್ಟರ್ ಫೀಲ್ಡ್ ಚೂಸ್ ಮಾಡಿದ್ದೀನಿ ಅಂದ್ರೆ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ನಾನು ಗುಡ್ ಲಿಸನರ್ ಆಗಿರ್ಬೇಕು.
ವೆರಿ ಗುಡ್.
ಯಾಕಂದ್ರೆ
ನೀವು ಕೂತ್ಕೊಳ್ರಿ, ಮಾತಾಡೋಕ್ಕೆಲ್ಲ ಕೂತ್ಕೊಳ್ರಿ, ನಿಂತು ಮಾಡಿ ಮಾತಾಡ್ಬೇಕು.
ಎಲ್ಲರೂ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಕ್ವಾಲಿಟೀಸ್ನ ಹೊಂದಿರಬೇಕು. ಯಾಕಂದ್ರೆ ಒಬ್ರು ತುಂಬಾ ಮಾತಾಡ್ತಾರೆ ಪೇಷಂಟ್ಸ್, ಒಬ್ರು ಜಸ್ಟ್ ಮಾತಾಡಕ್ಕೆ ಇಷ್ಟಪಡಲ್ಲ,
ಕೆಲವರು ಮಾತಾಡೋದಿಲ್ಲ.
ಮಾತಾಡೋದಿಲ್ಲ. ಸೊ ನಾವು ಮಾತಾಡ್ಬೇಕು ಅಂದ್ರೆ ಅವ್ರ
ತೆಗಿಬೇಕು.
ಆಮೇಲೆ ಒಬ್ಬೊಬ್ರು ಹೆಸಿಟೇಟ್ ಮಾಡ್ಕೊಳ್ತಾರೆ. ಈಗ ನಾನು ಒಂದು ಫಿಮೇಲ್ ಡಾಕ್ಟರ್,
ವೆರಿ ಗುಡ್.
ಸಮ್ ಬಾಯ್ಸ್ ಮೇಲ್ ಜೆಂಡರ್ಸ್
ಏನ್ ಆಗ್ಬೇಕಂತಿದ್ರೆ ಮುಂದಕ್ಕೆ
ನಾನು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ಬೇಕು.
ಎಲ್ಲಿ?
ನಮ್ಮ ಕಸಿನ್ ಹಾಸ್ಪಿಟಲ್
ಅವ್ರ ಜೊತೆಗೆ ಮಾಡ್ಬೇಕು ಫಿಕ್ಸ್ ಆಗಿದೆ. ಸೊ ಯು ಶುಡ್ ಚೇಂಜ್ ದ ಡ್ರೀಮ್. ವೆರಿ ಗುಡ್. ವಾಟ್ ನೆಕ್ಸ್ಟ್?
ಆಮೇಲೆ ಮತ್ತೆ ನಾನು ಪಂಚಕರ್ಮ ಇಂಟ್ರೆಸ್ಟ್ ಇದ್ದೀನಿ. ಸೊ ನಾನು ಪಂಚಕರ್ಮ ಮಾಡ್ತಿದ್ದಾರೆ.
ವೆರಿ ಗುಡ್, ವೆರಿ ಗುಡ್. ನೆಕ್ಸ್ಟ್ ಯು ಲೇಡಿ who is not looking at you. ಏನಾಗಬೇಕಂತ ಮಾಡಿ ನೀರೇ?
After completing this I want to become a pediatrician.
You want to become Kamar Bhutia. That is the pediatric specialty of Ayurveda. What become that? Very nice. Have you fixed that ideology?
Yes.
Very good. What about you? Third row, first lady.
So I want to become a lecturer.
Want to become a teacher?
Yeah.
Very nice. ಮತ್ತೆ ಯಾರ ಡ್ರೀಮ್ಸ್ ಹೇಳ್ರಿ, ಏನ್ ಆಗ್ಬೇಕಂತ ಇದೀರಂತ? ಯಾರ ಡ್ರೀಮ್ಸ್ ಎಲ್ಲ ಅವ್ರ ಕೈ ಎತ್ತಿ. I have no dreams. Simply coming here for the sake of my parents, sitting inside the class because the fees is being paid. I am going to walk out and ಯಾರಿದೆ ವಿಚಾರ ಅದನ್ನ ನನಗೆ ಹೇಳಿ. ನಿಮ್ಮ ವಿಚಾರ ಹಾಗಿದೆಯಾ? So you want to excel ಅಲ್ವಾ?
Yes, sir.
For which a patient listening is very important. ಡಾಕ್ಟರ್ ಪ್ರಶಾಂತ್ ಅವರು ನಾನು ಎಕ್ಸಾಂಪಲ್ ತಗೊಂಡು ಹೇಳ್ತಾ ಇದ್ರು, ನಿಧಾನ ಪರಿವರ್ತನ ಚಿಕಿತ್ಸಾ ವರ್ಡ್ ಕೇಳಿದ್ದೀರಾ? ಹ್ಯಾವ್ ಯು ಹರ್ಡ್ ಆಫ್ ದೀಸ್ ಥಿಂಗ್ಸ್? ನಂತರ ಒಂದು ಪೇರೆಂಟ್ಸ್ ಸ್ಟೋರಿ ಹೇಳ್ತೀನಿ, ಬೇಜಾರಾಗಿದೆ ಅಲ್ವಾ? ಕ್ಲಾಸಲ್ಲಿ 5 ವರ್ಷ ಇದೆ ಇರೋದು, ಬರೋದು ಪಾಠ ಮಾಡೋದು ಹೋಗೋದು. ಯು ವಿಲ್ ಬಿ ಬೋರ್ಡ್ ಆಫ್ ದಿ ಸಿಸ್ಟಮ್, ಸೊ ಯು ಶುಡ್ ಹ್ಯಾವ್ ಅ ಬ್ರೇಕ್. ಲೆಟ್ಸ್ ಹ್ಯಾವ್ ಅ ಸ್ಮಾಲ್ ಬ್ರೇಕ್ ನೌ, ಓಕೆ? ಅಂಡ್ ಅಗೇನ್, ಡೋಂಟ್ ಟಾಕ್ ಟು yourselves. Talk to me, question me, interrupt me, but don't talk amongst yourselves. This is the condition. ನೀವು ಮಾತಾಡೋದು ನಾನು ಈಚೆ ಹೋಗ್ಬಿಡ್ತಾರೆ, ನೋಡ್ತಾರೆ ನೀವು ಮಾತಾಡ್ತೀರಿ. ದಟ್ ಶುಡ್ ನಾಟ್ ಬಿ ಡನ್. ಗಂಡ ಹೆಂಡತಿ ಬಂದ್ರು, ಬ್ಯೂಟಿಫುಲ್ ಕಿಡ್. ಬ್ಯೂಟಿಫುಲ್ ಕಿಡ್ ಅಂದ್ರೆ ಆ ಬ್ಯೂಟಿ ಆಫ್ ದ ಕಿಡ್ ನ ವರ್ಣನೆ ಮಾಡಕ್ಕೆ ಆಗಲ್ಲ. ಆ ಮಗು ನೋಡಿದ್ರೆ ಮುದ್ದು ಬರುತ್ತಲ್ಲ, ನನ್ನ ಪುಟ್ಟು ಮಕ್ಕಳು ಪುಟ್ಟ ನಾಯಿ ಮನೆಯಿಂದ ಎತ್ಕೋಬೇಕು, ಅದನ್ನ ಹ್ಯಾಕ್ ಮಾಡಬೇಕು, ಎತ್ಕೊಂಡು ತಿರುಗಾಡಿಸ್ಬೇಕು, ಒಂದು ನೋಡ್ಕೊಂಡು ಬರ್ಬೇಕು. ಆ ಪುಟ್ಟು ಎಂಥ ಬ್ಯೂಟಿಫುಲ್ ಕಿಡ್. This story is around 20 years back. 20 years back, my parents got the small child to me. Child was pretty beautifully looking good. ಅದೇ ಸ್ಟೋರಿ ಡಾಕ್ಟರ್ ಪ್ರಶಾಂತ್ ಸರ್ ಅದರ ನೆಕ್ಸ್ಟ್ ವರ್ಷನ್ ಹೇಳಿದ್ದು, ನಾನು ಅದರ ಪ್ರೀವಿಯಸ್ ಕಾಂತಾರ 2 ಹೇಳಿದ್ರು, ನಾನು 1 ಹೇಳಿದ್ದೆ. ಕಾಂತಾರ 1ಗೆ ಕನೆಕ್ಷನ್ ಅವ್ರು 2 ಹೇಳಿಬಿಟ್ರು, ನಾನು 1 ಹೇಳ್ತಾ ಇದ್ದೀನಿ. ಸೊ ಬ್ಯೂಟಿಫುಲಿ ಲುಕಿಂಗ್ ಚೈಲ್ಡ್, ultimate child, very soft and sober child, 3 years plus child, very attractive. ಮಗು ನೋಡಿದ್ರೆ ಎತ್ಕೊಂಡ್ಬಿಡ್ಬೇಕು ಅಂತ. ನಾಟ್ ಆಲ್ ಚಿಲ್ಡ್ರನ್ ವಿಲ್ ಡಿಮಾಂಡ್ ದಟ್ ಅಟ್ರಾಕ್ಷನ್. ಪಾಪ ಆಶೀರ್ವಾದ ಬಿಸ್ಕೆಟ್ ಕೊಡು ನೋಡ್ರಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಓನ್ಲಿ ಫ್ಯೂ ಚಿಲ್ಡ್ರನ್ by the virtue of their fortune they look very attractive, very beautiful, very colorful. ನೋಡಿದ ತಕ್ಷಣ ಹಿಂಗೆ ಎತ್ಕೋಬೇಕು ಅಂತ ಅನ್ಸುತ್ತೆ. ಆ ಥರ ಮಗು. That came to my clinic. Very happy seeing the child. Bright red cheeks, lot of infection, bright red cheeks, oozing pus and things like that. And the presentation was very simple. The mother said, "Sir, we get the best of the best treatments done. We have got it done, the treatment done in US, the treatment been done in Bangalore, treatment been done in multiple places by all skin specialists, by all pediatricians, by all physicians, and the self-medication, though it is bad, we have also tried a lot of functional foods and home remedies, but the cheek infection comes down with right treatment, and later on, after some few days, again it recurs. Same condition, now it's in a better stage, so you're not appreciating the problem of fungus and things like that. It is very minimal now. Maybe 2-3 days afterwards it starts, a lot of itching, a lot of pus will come, this will happen. Again we give some treatment, the baby will be alright. We are in a fixed state of mind, we don't know what is to be done. Then I said, can I talk to the father? The father came inside. Talking to the father, he said, same question. How did the problem start? What is the treatment being done? What is your input for the child to improve? The same question what I put to the mother was put to the father as well. The father said, what all my wife has said is true. She is not lying. So the baby used to respond again. There is a lot of relapse in the problem, and the problem is there for 3-4 years now. We are fed up of the baby. We don't want the baby to be alive. If it goes, we will cry for 11 days and the matter is closed. But the baby is alive with so much of sufferings we cannot see. Then I said, I want to see all the files. They got me this much of files. Around 50 to 60 doctors had seen the patient for the past 3 years. And I said, I need 1 week's time to study this. Reading is not sufficient, studying is very important. When I wanted to study the files, I found every treatment, every logic, every prescription found to be logical and correct. What I meant to be prescribed, they had already prescribed, and the treatment was perfectly okay. But why the baby is not responding? But why was the question. Then I took a bold decision to call the parents and the child after 8 days, and I told the mother and the father of the beautiful little baby that I need to speak to all the kith and kin of the baby. ಆ ಮಗುಗೆ ಯಾರ್ಯಾರು ಸಂಪರ್ಕಿದಾರೋ ಅವರ ಅಷ್ಟು ಜನರ ಜೊತೆ ನಾನು ಒಂದ್ಸಲಿ ಮಾತಾಡಬೇಕು. The father was very angry. पैसा देने वाला मैं हूँ, इलाज करने वाला मेरा बीवी है, इलाज देने वाला मेरा बच्ची है, आप सबसे बात करना जरूरत क्या है? This was the beautiful question what he put. Not quite logical at this point. He was spending money, his wife was giving medications, the baby used to take medications, I am prescribing, the baby should be alright, correct? No? Anything wrong in this picture, in this story, anything wrong? Nothing wrong. So, things are not working. Then I said, no sir, if this is the case, I can't treat the child. But if you want me to treat the child, I need to talk to everyone connected to the baby. 7th day from then on, 8 plus 15 days. 7th day from then on, they got to me, all the people around 8 to 9 cars, they saying that this is Maushi, this is uncle, this is auntie, this is Dodappa, this is Dodamma, this is my neighbor, this is my classmate. And I said, I will talk to them for a few minutes. I started calling one by one to my chamber, spoke to them for 4 or 5 minutes, and I used to send them. Finally, I got the culprit. The culprit was husband and wife had a common friend. She was a classmate to the wife and also a family friend to the husband. So wherever they are, husband and wife in Bangalore, that neighbor, husband and wife's common friend, family friend, used to stay next to her door. He was married, that husband's friend was not married. Because he was not married, And fortunately, the baby was like an angel, beautiful, good looking. She used to take care of the baby much more affectionately than the mother. Wherever the father migrated because of the software works, wife was accompanying husband because of dharma. The colleague, because his wife, friend and classmate and same qualification and same equivalence, she used to try living together in a US, in Bangalore, in multiple places. She was very good looking. She had a beautiful lipstick. I said, how do you take care of the baby? She said, every day, correct. ಎಂಥ ಟಾಮ್ ಡಿಕ್ ಅಂಡ್ ಹ್ಯಾರಿ ಆ ಮಗು ನೋಡಿ ಎತ್ಕೊಂಡು ಹೊತ್ಕೊಡ್ಬೇಕು ಅನ್ಸುತ್ತೆ. ಆ ಮಗು ಹಾಗಿದೆ, ಅದ್ರ ಬಗ್ಗೆ ಯಾವ ಡೌಟ್ ಇಲ್ಲ. Such beautiful child was allergic to her lipstick. Such a beautiful child, cheeks were being irritated, allergies to happen and irritate, flare up, pus formation, itching, scratching. The baby used to cry for no fault of the baby and no fault of the mother also, because she did not know that the lipstick was a positive factor. She was to kiss the baby, give the baby to the school and go, and the problem would trigger. And again, post-triggering, all creams, lepanas, churnas, kashayams, feeding, everything was being done. It subsided. Once the skin was soft and supple, again the lipstick contact would happen and the problem would continue persistently. And this is the cause for all the 3 years as to why the baby was not permanently recovering. You know what was the treatment? Can any one of you tell now what could be the treatment? Don't tell me what medicine name. I don't expect this from you at this point of time. Tell me what could be the treatment, line of treatment. ಈಗ ಇಲ್ಲಿಂದ CBTಗೆ ಹೋಗ್ಬೇಕಂದ್ರೆ ಓಲಲ್ಲಿ ಹೋಗ್ಬೋದು, ಬಸ್ಸಲ್ಲಿ ಹೋಗ್ಬೋದು, ಫ್ರೆಂಡ್ ಡ್ರಾಪ್ ಮಾಡ್ಬೋದು, ಆಟೋ ಹೋಗ್ಬೋದು. 4 ಆಪ್ಷನ್ಸ್ ಇರ್ತಾವಲ್ಲ, ನಡ್ಕೊಂಡು ಹೋಗ್ಬೋದು, 5 ಆಪ್ಷನ್ಸ್ ಇರ್ತಾವಲ್ಲ. ಹಾಗೆ ಹೌ ಡು ಯು ಫೀಲ್ ದಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಡನ್? ನಿಮ್ಮ ಪ್ರಕಾರ ಹೆಂಗೆ ಮಾಡೋದು ಟ್ರೀಟ್ಮೆಂಟ್? ಲೌಡರ್, ಸ್ಟ್ಯಾಂಡ್ ಅಪ್ ಅಂಡ್ ಸೇ, ಡೋಂಟ್ ಫಿಯರ್, ಸ್ಟ್ಯಾಂಡ್ ಅಪ್ ಅಂಡ್ ಸೇ. Even if you are wrong, I will not scold you. Say.
Like that baby needs to stop exposing to that lipstick.
What is that called as?
Sorry?
What is that called as? You are right. Technically you are right. Theoretically you need to be different. What is that called as? That is called as Nidhana Parivarjanameva Chikitsa in Ayurveda. Treatment of root cause is the right line of treatment. Correct ಆಗಿ ಹೇತು ಚಿಕಿತ್ಸಾ ಅಂತ ಹೇಳ್ತಾರೆ ಡಾಕ್ಟರ್ ಪ್ರಶಾಂತ್ ಸರ್. ಅರ್ಥ ಮಾಡ್ಕೊಂಡ್ರಾ? ಕರೆಕ್ಟ್ ಆಗಿ ನೋಡಿ ಹುಡುಕಿ ಹೆಕ್ಕ ತೆಗೆದು ಇದ್ದು ಪ್ರಾಬ್ಲಮ್ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ. ಇದ್ದು ಪ್ರಾಬ್ಲಮ್ ಅಂತ ಹುಡುಕಕ್ಕೆ ನಿಮ್ಮ ಎಜುಕೇಶನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಅಲ್ಲ, ನಿಮ್ಮ ಇಂಟೆಲೆಕ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್. ಇದಕ್ಕೆ ಕಾರಣ ಇದೆ ಅಂತ ಗೊತ್ತಾಗಕ್ಕೆ ನಿಮ್ಮ ಎಜುಕೇಶನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಅಲ್ಲ, ನಿಮ್ಮ ಪೇಷನ್ಸ್. ಎಜುಕೇಶನ್ ಡಿಗ್ರಿ ಬೇಕು, ಮಾಸ್ ಕಾರ್ಡ್ ಬೇಕು, PG ಸೇರಕ್ಕೆ ಅಡ್ಮಿಷನ್ಗೆ ಬೇಕು, PhD ಸೇರಕ್ಕೆ ಒಂದು ಬೇಸಿಕ್ ಇರಬೇಕು, ಎಲ್ಲರೂ ಸೆಕೆಂಡ್ ಅಂತ ಬೇಕು. ಬಟ್ ಟು ಬಿ ಮೋರ್ ಸಕ್ಸಸ್ಫುಲ್ ಇನ್ ಲೈಫ್, ಯುವರ್ ಐಸ್, ಯುವರ್ ನೋಸ್, your ears, when you hold the pulse, your pulsative sense, ಪಂಚ ಜ್ಞಾನೇಂದ್ರಿಯಗಳು ಅಂತ ಕರಿತೀವಲ್ಲ, ಶಬ್ದ, ಸ್ಪರ್ಶ, ರೂಪ, ರಸ, ಗಂಧ. These ಪಂಚ ಜ್ಞಾನೇಂದ್ರಿಯಗಳು or 5 senses has to be more activated for a physician, for a student. Sanskrit we say, ಕ್ಷಣಶಃ ಕಣಶಶ್ಚೈವ ವಿದ್ಯಾಂ ಅರ್ಥಂಚ ಸಾಧಯೇತ್. ಕ್ಷಣತ್ಯಾಗೇ ಕುತೋ ವಿದ್ಯಾ ಕಣತ್ಯಾಗೇ ಕುತೋಧನಂ. ಕೇಳಿದರೆ ಯಾರಾದರೂ? Have anyone of you, none of you have taken Sanskrit in your second PUC? None of you, any Sanskrit students in the second PUC here? Not even one? The Sanskrit classes have started. I want you to kindly go through Shubhashitas. And one artha ಮಾಡ್ಕೊಳ್ಳಿ, if you don't learn Shubhashitas willingly or unwillingly at this given point of time, that might be shlokas, because that is the strong depth for you to acquire the. Please sit down, lady. Please sit down. Please sit down. That is the strong depth for you to attain long-term memory. Dhirti Smriti is what we say. Memory, retention, recognition, intelligence part has to be marked very fast only when you are a very good listener, very good seer. You should see. I was thinking about the treatment of success alone. Success protocol ಹೇಳ್ತಾ ಇದೆ. I stopped that in between for the reason that I wanted you to ask me. But all of you are dumb. ಕೇಳಿಸ್ತಾ ಇದೆ? At least are you audible? Only lips are closed, ears are open, right? What is the story of success according to you ಅಂತ ಕೇಳ್ತಾ ಇದೆ. ಯಾರು ಹೇಳ್ತೀರಾ? You gentlemen, you tell me. You, the first from gentleman. What's your name? Huh? Pranav? Uga? Pranav Patil. You are the one who gave me the rose. Okay. Tell me, what do you want to become? Huh? Loud boss. What is the definition of a good physician? Matare, even if you are wrong, then nothing is going to be harmful. Tell me. What is the qualities of a good physician? Being with a white neat apron and a tuck shirt, good shoe, good perfume, good hairstyle makes you a good physician? How? What about you? The next person. He is feeling happy that he has not been asked. Please get up. You are the last next to the window. Feel comfortable. This is not an examination or a class to target you. Feel free. What is the signs of a good physician? No answer. Nirma, second lady. Mundare, please now.
More patience.
Huh. Then,
Polite.
very good. Polite, more patience, neat and clean, presentable. What next? You lady, the one behind.
Good communication skills.
Excellent. According to you,
Should be more clear and
clear your speech and words, expressive is what you mean. What about you? Good knowledge. Okay. Huh?
Firstly, should be a good listener.
Good listener. Okay. What about you?
so her patients are satisfied with
How will you satisfy? Yeah, I'm hungry. I have come to your table for lunch. How will you satisfy? Give me 1 roti, 10 rotis, give me rice, give me biryani. What makes me satisfied? According to you. I am a patient now.
the taste of that dish.
Ha, you should understand the taste of the patient. What he wants from you has to be understood by a physician. Very valid point. You?
Should be kind.
Excellent.
And
Very good.
should they be able to feel the pain of the
ಎಲ್ಲರಿಗೂ ಚಾನ್ಸ್ ಬರ್ತಿದೆ ಈಗ. Be ready. And no repetition. Huh? If you are thinking I am selecting one by one, that's not there.
should be able to feel the pain of the patient.
Loud and clear.
Should be able to feel the pain of the patient.
Very good. By default. By default. Huh.
Good common sense.
Good common sense. Very good. ಆಯ್ತಾ ನಿಮ್ದು ರೋಲ್ ನಂಬರ್ ಆಗೋಯ್ತಾ?
Correct the prescription for disease.
ಹಾ, ವೆರಿ ಗುಡ್.
The patient should feel comfortable.
Loud.
The patient should feel comfortable talking to the doctor.
Very good. Fast. You only get up and say,
He should feel the pain of the
how? If the dog has bitten me, will you feel the pain? There is a dog biting me and I am bleeding here. You will feel my pain. What you mean is what I understood is you should have empathy and sympathy for the patient. Alva? I am there for you, the Bujata. Don't worry. Kachitana, and take care. Give me 2 minutes. We'll put some alcohol, we'll put some saline, we'll put something, we'll do dressing, we'll see the bandage, and so on. Is that what you mean, right? That is what you mean, right? Okay.
dedication.
Okay, done.
Should have good healing hands.
Loud and clear.
Should have good healing hands.
Healing hands. Okay, next.
Should be skilled.
Skill. Okay.
Clearly know the cause of the death.
Okay, fair. Patience. Means when there are no patients in the office, you should be happy. Okay, next.
Politeness and communication.
Done. Knowledgeable. Okay.
Should have practical and
Excellent. If you are not audible here, you are not audible in life. बहुकल्पं बहुगुणं संपन्नं योग्यरोषम् अनुरक्ष्य शुचिर्दक्षो Very good. Very good. Syllabus start ಆಗಿದೆಯಾ? Huh? Not in a single class started. Okay. What are you doing in the class then every day? Huh? So ಇದಕ್ಕೆ ಒಬ್ಬರು ಆನ್ಸರ್ ಕೊಡ್ತೀರಿ, ಇದಕ್ಕೆ ಎಲ್ಲರೂ ಕೊಡ್ತೀರಾ? ಎಲ್ಲರೂ ಕೊಟ್ಟಿದ್ರೆ ಯಾರು ಕೊಡಂಗಿಲ್ಲ? You say. Business ಏನ್ ಮಾಡ್ತಿದ್ರಿ? Every day ಮಾಡ್ತಾರೆ. ಎಲ್ಲಿ ಮಾಡ್ಕೊತಾರೆ ಪಾಯಿಂಟ್ಸ್ ನೋಟ್? ಎಲ್ಲೂ ಪೆನ್ನೇ ಇಲ್ಲ ಪೇಪರ್ ಇಲ್ಲೇ. ಡೈರೆಕ್ಟ್ ಟ್ರಾನ್ಸ್ಫರ್ಮೇಷನ್ ಟು ದ ಡೇಟಾ ಲೈನ್. Okay, next. ಗುಡ್ ಲಿಸ್ಟರ್ ಆಗಿದ್ದೆ ಹೇಳಬಾರ್ದ, ನಿಮ್ಗೆ ಜೋರಾಗಿ ಹೇಳಿ ಅಂತ ನಿಮ್ಗೆ ಬೇರೆ ತೋರಿಸಲಿ ಅಂತ. ನೆಕ್ಸ್ಟ್ ಹೌ ಗುಡ್. I'm hungry. What is food? I'm hungry. Okay. Who is going to feed me? Huh? Patience or patience? Patience. Pardon. Okay. Next. Diet management. Huh? Time management. Okay. Next. Honesty. Very good. Very good. Are you to yourself? Are you to yourself? You are trying to. Yes. Very good. Next. Okay. Okay. Done. Next. Next. That is the repetition of the all marking. How? How? ದ್ರವ್ಯಗಳ ಬರ್ತದಲ್ಲ, ರಸಶಾಸ್ತ್ರ ದ್ರವ್ಯಗಳು ನೆಕ್ಸ್ಟ್ ಇರಲಿ. A1 ಇಂದ this question is by you, but the answer is to all of the team. All of the silence. Proper knowledge of medicines ಅಂದ್ರೆ day 1 of your college ಅಕ್ಕಪಕ್ಕ ಇರೋ ಎಲ್ಲ ಹರ್ಬ್ಸ್ನ ನೋಡೋದು, ಫೀಲ್ ಮಾಡೋದು, ಅದ್ರ ಲ್ಯಾಟಿನ್ ನೇಮ್ ತಿಳ್ಕೊಳ್ಳೋದು, ಸಂಸ್ಕೃತ್ ನೇಮ್ ತಿಳ್ಕೊಳ್ಳೋದು, ರೀಜನಲ್ ಲ್ಯಾಂಗ್ವೇಜ್ ನೇಮ್ ತಿಳ್ಕೊಳ್ಳೋದು, ಅದರ ಯುಟಿಲಿಟಿ ತಿಳ್ಕೊಳ್ಳೋದು ಇವತ್ತಿಂದ ಮಾಡಿ. ತುಳಸಿ, ಏಲಕ್ಕಿ, ಲವಂಗ, ಮೆಣಸು, ಜೀರಿಗೆ, ಅರಿಶಿನ, ಹನಿ, ಹಾಲು, ಸಗಣಿ, 1000 ಪದಾರ್ಥಗಳು, ಪ್ರತಿಯೊಂದು ದ್ರವ್ಯ ಏನು ಕಣ್ಣು ಮುಂದಿರ್ತಾವೋ ಅದರದ್ದು ಬೇಸಿಕ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಮೆಡಿಕಲ್ ಥೆರಪ್ಯೂಟಿಕ್ ಆಕ್ಷನ್ ಏನು ಅಂತ ಸುಮ್ಮನೆ ಟೈಮ್ ಪಾಸ್ಗೆ ಮೊಬೈಲ್ ಅಲ್ಲಿ ಸ್ಕ್ರಾಲ್ ಮಾಡ್ತಿರಲ್ಲ, ಹಾಗೆ ರೋಲ್ ಆಫ್ ತುಳಸಿ, ರೋಲ್ ಆಫ್ ಅಶ್ವಗಂಧ, ರೋಲ್ ಆಫ್ ಜೀರಾ, ರೋಲ್ ಆಫ್ ಟರ್ಮರಿಕ್, ಹಿಂಗೆ ಮಾಡ್ತಾ ಬನ್ನಿ. ಸಾಕಷ್ಟು ನಾಲೆಡ್ಜು, ಇಂಟ್ರೆಸ್ಟು ಆಯುರ್ವೇದದಲ್ಲಿ ಬರುತ್ತೆ. ವೆರಿ ಗುಡ್. ನೆಕ್ಸ್ಟ್. You are not a good communicator if it is not reaching me. How to develop that? From this onwards, the last lady should come here. ಒಬ್ಬರೊಬ್ಬರು ಇಲ್ಲಿ ಬಂದು ಮಾತಾಡೋಣ, ಕೇಳೋದಿಲ್ಲ. Come here. Say and go. Be ready. This onwards, you have to come here, talk and go. Communication. Okay, next. Silence. Your chance will come. Pardon me? Skilled diagnosis. How will you make a skilled diagnosis? Can you elaborate? You come here, please. Next, this one. Come here. Be ready. One by one. Come here. Please come. Come here. Come here. Then I will ask the next person sitting to you whether she has listened to your words or not. Next stop. Come here, fast. One by one. Come here. Illi banni. Alli bandu ಏನು ಅಂತ ಹೇಳ್ಕೊಳ್ಳಿ. Next, be ready to come. So then what to me? Very good. Next. Come fast. Next, be ready. Come, you can be on the queue. Silence.
Should be a
You want me to listen to you. What is the technique that you will hold? You are there, all of you. I'm not a good listener. You are a good listener. But I don't express my problems to you. I say, not in a class, but I will be having headache. How will you know that I have a headache? How will you face me by being a good listener? ಇದ್ರ ಬಗ್ಗೆ ವಿಚಾರ ಮಾಡ್ರಿ. ನೆಕ್ಸ್ಟ್ ಅಲ್ಲಿದ್ರೆ ಜೋರಾಗಿ ಹೇಳು, ಇಲ್ಲವೇ ಇಲ್ಲವರು ಚಾಯ್ಸ್ ನಿಮ್ಮದೇ. ಅಲ್ಲೇ ನಿಂತ್ಕೊಂಡು ಹೇಳ್ತಿದ್ರೆ ಜೋರಾಗಿ ಹೇಳು. ವ್ಯಾಲಿಡ್ ಪಾಯಿಂಟ್ ಸಾಕು. ಒಳ್ಳೆ ಲೀಡರ್ಶಿಪ್ ಕ್ವಾಲಿಟಿ ಇರಬೇಕು. ನೆಕ್ಸ್ಟ್ ಎಕ್ಸಲೆನ್ಸ್. Excellent. Next. Okay, fine. Accepted. Next. Illi last. Confidence. What did you say? Confidence, huh? Okay, next. Ready, illa? Courageous, okay. How will courage help you become a good doctor? The patient doesn't come, you go to his house. Okay, as the time is running short, I need to leave to other parts of Karnataka now. Nice. ಈಗೆಲ್ಲರೂ ಒಂದು ಟ್ರಯಾಂಗಲ್ ಇಮ್ಯಾಜಿನ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಕಣ್ಣು ಕ್ಲೋಸ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಪಿರಮಿಡ್ ಟ್ರಯಾಂಗಲ್ ಇಮ್ಯಾಜಿನ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಇದೆಲ್ಲ ಪೇಪರ್ ಬಂದಿದ್ಯಾ? ನೋಡಿ ಟ್ರಯಾಂಗಲ್ ಬರೀರಿ ದೊಡ್ಡದಾಗಿ. ಪೇಜ್ ಫುಲ್ ಬರೀರಿ ಟ್ರಯಾಂಗಲ್. ಪೇಜ್ ಫುಲ್ ಟ್ರಯಾಂಗಲ್ ಬರೀರಿ. ದೊಡ್ಡ ಟ್ರಯಾಂಗಲ್ ಬರೀರಿ ಪೇಜ್ನಾಗೆ. ಫುಲ್ ಪೇಜ್ ಟ್ರಯಾಂಗಲ್. I am trying to summarize what all we have discussed hitherto in a nutshell now. Okay? Anyone of you get one? Can you open code? What is the code? Can you use the sheet? Is this triangle visible to everyone?
Yes, sir.
All of your triangles are ready?
Yes, sir.
This is the secret of success, right? ಇವೆಲ್ಲ ನಂಬರ್ 1 ಆಗಬೇಕು ಅಂತ ಯೋಚನೆ ಮಾಡ್ತಿದ್ದೀರಲ್ವಾ? This is the secret of success, right? ಇಲ್ಲಿ ಬರಬೇಕು. You have to come here to be more successful, right? What is the modus operandi? ಹೆಂಗ್ ಬರ್ತೀರಿ ಇಲ್ಲಿಗೆ? ಇಲ್ಲಿದ್ದೀರಾ ಈಗ. You are here. From here to here, how will you reach? ಬೇಗ ಡ್ರಾ ಮಾಡಿ ನೋಡೋಣ. ಹೆಂಗ ರಫ್ ಡ್ರಾ ಮಾಡಿ, ಟೈಮ್ ಇಲ್ಲ. ಹೆಂಗ ಇಲ್ಲಿಂದ ಇಲ್ಲಿ, ಇಲ್ಲಿಂದ ಇಲ್ಲಿ, ಇಲ್ಲಿಂದ ಇಲ್ಲಿ ಹಿಂಗೆ. ಇಷ್ಟು ಜನ ಇರ್ತಾರಲ್ಲ ಈ ಮಧ್ಯ. ನಿಮ್ಗಿಂತ ಎಲ್ಲ ಡಾಕ್ಟರ್ಸ್ ಹಿಂಗೆ ಇರ್ತಾರಲ್ಲ. ಆಯುರ್ವೇದ ಕಾಲೇಜ್, ಹುಬ್ಳಿ, ಬೆಳಗಾವಿ, ಶಿವಮೊಗ್ಗ, ದಾವಣಗೆರೆ, ರಾಯಚೂರು, ಬೆಂಗಳೂರು, 15 ಕಾಲೇಜು, ಇಂಡಿಯಾ, ತಮಿಳುನಾಡು, ಕರ್ನಾಟಕ ಎಲ್ಲ ಹಿಂಗೆ ಬಂದು 2025 ಬ್ಯಾಚಲ್ಲಿ ಹಿಂಗೆ ಇರ್ತಾರಲ್ಲ ಇಷ್ಟು ಜನ. ಹೆಂಗೆ ನಂಬರ್ 1 ಹೆಂಗೆ ಆಗ್ತೀರಿ? ಬಿಲ್ದೆಲ್ಲ ಸುಮ್ಮನೆ ಹಿಂಗೆ ಮಾಡ್ತಾರ. ಎಕ್ಸಾಮ್ ಇದೆ, ವೈಭವಸಿ, ಸೈಲೆನ್ಸ್. ಎಕ್ಸಾಮ್ ಇದೆ, ವೈಭವಸಿ ಇದೆ, ಜಲಸ್ ಇದೆ, ರೇಸಿಸಮ್ ಇದೆ, ನಾರ್ತ್ ಕರ್ನಾಟಕ, ಸೌತ್ ಕರ್ನಾಟಕ ಇದೆ, ಸೌತ್ ಇಂಡಿಯಾ, ನಾರ್ತ್ ಇಂಡಿಯಾ ಇದೆ, UG, PG ಇದೆ. Not many debates and hurdles, no? How will you become number 1? I am doing your work on your behalf. This is your book. How will you become number 1? Here to find the great gentleman, only 2 in number. What is your goal? One way is you work asadhya, because people will not let you grow. ಕಾಲು ಎಳೆಯೋ ಮುಂದೆ ಭಾಳ ಇರ್ತಾರೆ. ಸೆಕೆಂಡ್ ಥಿಂಗ್ ಇಸ್ ಹಿಂಗೋಗಿ ಬಂದು ಕಡೆಗೆ 90ನೇ ವಯಸ್ಸಿಗೆ ನಾನು ನಂಬರ್ 1 ಡಾಕ್ಟರ್ ಆಗಲಿ. ಹೌದಿಲ್ಲ? ಎರಡು ಬಿಟ್ಟು there is a beautiful lucrative way to become number 1 on the day 1 of your career. How is it? Everyone is looking this way, right? You look this way. You are number 1 at this very moment. This is what is success. When you have a different perspective in thinking, experiencing, exploring the science, then you have lot many opportunities. One student in 1996 sitting in the first bench. Today, when he is able to visit 9 countries, when he is able to be an advisor to the state government, a part of Kannada Development Authority, when product of this college, be a part of central government as an advisor to the censor board, with this particular student in this community, this hall, this place, can head Karnataka Cancer Society as a vice president. One common student, just 30 years before being here, is heading India Ayurveda Foundation today and Swastha Samprada Bharata. Why can't you? Is the question. You can, you will, and you should is the answer. Thank you one and all for the patient listening.